Let's discuss the Norma occipitalis, or the posterior part of the skull. So the bones involved in the formation of Norma occipitalis are parts of the parietal bones on the two sides, then the occipital bone, this one, and partly we can see the mastoid part of the temporal bone on either side. So the Norma occipitalis, or the posterior of the skull, is formed by the parietal bones, the occipital bone, and the mastoid parts of the temporal bones. The various sutures that we can see on this norma are the lambdoid suture. This is a lambda shaped suture between the parietal bones and the occipital bone. The next suture that we can see is called the occipito-mastoid suture, this one, between the occipital bone and the mastoid bone, mastoid of temporal. This is the occipito-mastoid, and the other suture is the parieto-mastoid suture, this one. So the three sutures that we can see on the Norma occipitalis are the lambdoid suture, the occipito-mastoid suture, and the parieto-mastoid suture. Then we can see the prominence here called the external occipital protuberance. This is a prominent part of Norma occipitalis. The external occipital protuberance is an elevation on the posterior of the skull. Now there are two lines called the superior nuchal lines that go on either sides from the external occipital protuberance. These are the superior knuckle lines. And 1 centimeter above these lines, sometimes there is another line present called the highest nuchal line, which is not present in this one. The attachment on this external occipital protuberance is such that on the upper part it gives attachment to trapezius muscle, and the lower part there is attachment of the ligamentum nuchae. The superior nuchal line, the medial part, it gives attachment to the trapezius muscle here, and laterally it gives attachment to two muscles. Superiorly it gives attachment to the sternocleidomastoid, and inferiorly it gives attachment to the splenius capitis muscle. So the superior nuchal lines gives attachment on the medial part to trapezius, and on the lateral part to the sternocleidomastoid above and splenius capitis below. Then if the highest nuchal line is present, it gives attachment medially to the epicranial epineurosis and laterally to the occipitalis muscle. But if, like in this skull, this higher nuchal line is not present, the superior nuchal line gives attachment to these. On the medial part, it gives attachment to the epicranial epineurosis, and on the lateral part, it gives attachment to the occipital part of the occipitofrontalis muscle. So this is about the Norma occipitalis, having parietal bones, the occipital bone, and the mastoid part of the temporal bone, the sutures lambdoid, occipitomastoid, and parietomastoid, and this external occipital protuberance and the subsequent superior nuchal lines. This is about the Norma occipitalis, or posterior part of the skull. This is the front of the skull, also called the Norma frontalis. The bones involved in formation of the Norma frontalis are the frontal bone, the zygomatic bone, maxillary bone, the nasal bone, and the mandible, which is not present here, which forms the lower jaw. So we'll discuss these one by one. First of all, we'll discuss the frontal area. The frontal area is smooth above, and below it has irregularities, which includes the orbital, this orbit, and the nasal area. The superciliary arches are prominences on the medial margin of the supraorbital area. So this and this are the superciliary arches. Both of these meet in the center at a point that is called the glabella. Now the frontal bone is communicating with the nasal bone here at the frontonasal suture. This one is the frontonasal suture. This is the supraorbital foramen or notch through which the supraorbital nerves and vessels pass. These are two in number. both at the above the level of the supraorbital margins. Then we have the orbit. The orbit has four borders. The supraorbital border is formed by the frontal bone. The infraorbital margin is formed partly by the zygomatic bone laterally, and the zygomatic bone laterally, and the frontal process of maxilla medially. Then the medial margin of the orbit is formed by frontal bone above and the frontal process of maxilla below, and the lateral margin is formed by the zygomatic process of frontal bone, this one, and the frontal process of zygomatic bone below. So the four orbital margins are formed by superiorly by the frontal bone only, inferiorly by the zygomatic and maxillary bone, medially by the frontal and zygomatic bone, and laterally by the frontal and zygomatic bone. Zygomatic bone is the one that is forming the cheek prominence, this one. These are the two zygomatic bones having the zygomatic-official foramen. These are the zygomatic-official foramina. Now let's discuss the nasal aperture. It is pear-shaped and it is formed above by the nasal bone. The two nasal bones meet at the internasal suture. This we can see in the center. This is the internasal suture. Below are the notches of maxilla, this and this. These notches are forming the base of the anterior nasal aperture. In the middle is the anterior nasal spine, this one. The nasal bone is communicating above with the frontal bone at the frontonasal suture. Anteriorly, it is communicating with the nasal bone of the other side at the internasal suture. Posteriorly, it is meeting with the maxilla. So this is pear-shaped opening called the anterior nasal aperture. Now if we see at the maxilla, maxilla is the bone that is forming the upper jaw. It has three processes: the frontal process of maxilla, the zygomatic process of maxilla, and the alveolar process of the maxilla. So these are the three processes of the maxilla. Now maxilla has these two notches which are forming the base of the anterior nasal aperture. It has two fossae. One is the incisive fossa above the incisors and the canine fossa above the canines. So this one is the maxilla, having three processes: the alveolar process, frontal process, and the zygomatic process.